by saying that it is late, but it's better late than never. Our medical system or our healthcare system is too much skewed to the curative healthcare rather than the preventive healthcare. I know that some years back, the Ministry of Health, under the auspices of the late Kwashika, who tried to introduce what we call the regenerative health and nutrition concept by the Ministry of Health. But it's like it wasn't given sufficient push, and we've gone back to the curative aspect of care rather than the preventive. If you go to our hospitals, it's all about detecting what the diseases are and then giving medications. And there is little that is done to encourage people to test, to come to hospitals and clinics and so on to test for their diseases. They have even, in case they have underlying conditions, they have even posted dietitians to some of the hospitals. But if you interact, some of them are my students. They are sitting down there. They don't refer cases that need diet counseling and so on to them. People don't take these silent killers, diabetes, hypertension, and so on. They don't take them serious because they don't perceive it as threatening. And it's a combination of ignorance about the prevalence of the non-communicable diseases, and then the fact that the diseases that don't pose a threat, like you don't have fever, you don't have headache, and so on, people don't take it serious. And let me give you some few statistics. It's very frightening. There's always a global burden of diseases that is done. That is usually 10 years. And in Ghana, when the global burden of disease studies was done, between 2009 to 2019, listen to the startling statistics. You will see that when we look at the causes of death, the most causes of death, malaria is number one between 2009 to 2019, but it dropped by over 33%, almost 34%.
Right.
Stroke increased from number 5 in 2009 to the second position. Whoa. And it increased by 25.2%. If you look at the lower respiratory tract infection, it dropped by 0.5%. Neonatal disorder, these are non-communicable diseases, dropped by 18.5%. If you look at ischemic heart disease, that's a heart conditions, apart from stroke, it increased by 37.6%, rising from number 7 cause of death to number 5. And then you come to diabetes. Number 9 cause of death increased by 24.6%. And then cirrhosis of the liver, 12.3%. That is rising. So there is what we call the epidemiological transition. That when a country is developing, the diseases that are communicable diseases give way to diseases that are non-communicable diseases or lifestyle diseases like diabetes, hypertension, and the other cardiovascular diseases I've mentioned, kidney diseases, and so on. Yeah. So you see that Ghana is on a ticking time bomb. We have a serious epidemic of overweight, and people are walking and are at risk of getting type 2 diabetes, and they don't see it important to go to the facilities to check their BP, check their weight, so that they'll look at their body mass index and be able to predict their risk of getting hypertension or diabetes, and then do what we call primary prevention. Primary prevention is to make sure that you check, and if there is the risk of getting the disease, then they will already talk to you about diet, they will talk to you about exercise, and so on and so forth. Then you will never get it. So we are used to this secondary or tertiary prevention, where the thing has already happened, and now we want to solve it. And like my earlier speaker said, it is more expensive and more difficult to deal with the secondary and tertiary prevention level than the primary prevention. So what I'm seeing that the health insurance wants to do is to promote primary prevention so that every Ghanaian will have the opportunity to be checked. And then I understand, I'll check at Ghana Web and saw they are saying that if they check them at the health facilities, those who don't have health insurance, they will use the opportunity to register them. So they will be killing two birds with one stone.
Right.